the scenario we'll hear is I'm at a Fortune 500, Fortune 100 company, like you said, employee W-2, have phenomenal healthcare coverage, and the costs are low. That's holding me back from retiring, even though my nest egg, my savings tell me I can retire earlier. They're concerned about, well, my premiums are going to double, triple. I know maybe the answer depends, your personal situation and whatnot, but like any guidance on like budgets, like what, like, is that a myth or could that be reality?
So it could be reality. I mean, depending on if you're paying nothing for your health insurance through your employer, they're covering 100% of premiums, anything's going to feel expensive. And the other thing is we look at health insurance outside of, a job. Like I mentioned, the Affordable Care Act, premiums went up, and there are advanced premium tax credits and ways you can bring that down, which we'll talk about a little bit further. As you think about what to budget, it really does depend. Now, the Affordable Care Act, and some other legislation, 2021, actually, that was passed, did a couple of things. One, it removed the income cap to be able to receive advanced premium tax credits on the marketplace, which we'll talk about a little bit further here in just a second. And it also capped health insurance premiums for the silver benchmark plan, so basically the middle of the road plan, at no more than 8.5% of your modified adjusted gross income. And so, yes, your health insurance may be more expensive than what you paid when you were at your employer. Most of the time it is. I'll be honest with you, most of the time when you're making that transition away. But all of that to be said, we never, at Move Health especially, we never believe that health insurance should be the thing that is holding someone back from retiring. Full stop. We don't think that should be something that stops someone. There's too many good options that are available out there for people, a lot of different strategies that someone can leverage.
Healthcare planning strategies, ones that you would think are worth mentioning, and then maybe others that you would caution against?
So this is really just a cautionary statement of just understand what the coverage that you have does, and more importantly, does not do, right? So the ACA marketplace, the Affordable Care Act marketplace, has, 10 essential health benefits that must be covered. These are things like maternity and things like prescriptions and things like pre-existing conditions, and it must cover ambulance rides, and it must cover, all of these mental health, things along those lines. So, that's something important to note, is understanding what your coverage will and will not do, because there are health insurance coverages that will be pitched as full major medical, there's no network, things along those lines. They'll look really, really good, but in reality, they won't cover a pre-existing condition. There's no maximum out of pocket. Your deductible is $15,000, right? And so there are things, just understanding what your options are, making certain that you are informed, that you know the unique pros and cons of each option that's out there. The Affordable Care Act, as I mentioned, big piece of healthcare legislation, made certain that people with pre-existing conditions could get health insurance coverage. Prior to the Affordable Care Act, people would want to retire, and we saw this, in the health insurance space, where people would say, "Hey, I'm 61, I want to retire, I've got the funds to do so. Get me some health insurance." And we'd go, "Hey, you had a heart attack 3 years ago. There's not an insurance carrier that's going to take you," right? And it was these conversations you have to have like that are tough. Now, with the Affordable Care Act, we can go, "Hey, guess what? You're going to be a good fit for marketplace coverage. And it's going to cover the 10 essential health benefits. It's going to cover your prescription meds. It's going to cover your cardiologist that you now see, biannually, all of those things. It will cover those." And so that's a big piece of what the Affordable Care Act did. So folks that have, pre-existing conditions, you can get health insurance coverage outside of your job. So if you're holding on to it because you had a diagnosis and you're waiting out some time to get past that so you can pass underwriting for health insurance, you don't need to worry about that.
That's a great point.
Been guaranteed issue since 2014. And there are times where I will tell a financial advisor that and they'll go, "Whoa, my mind's blown. I didn't know that." So if you've got a pre-existing condition, you can get health insurance coverage. That's an important piece of the Affordable Care Act, largely one of the biggest ones. The other one we talked about is, health insurance premiums skyrocketed when they introduced and said, "Hey, everybody can get health insurance now," right? An actuary said, "Put everybody in the highest risk pool. We're going to assume everybody is high risk for everything." Or the example I use most often is we're going to assume that everybody's undergoing some type of really expensive treatment, right? And so they put everybody in that highest risk pool. And so premiums went up 300% overnight in 2014. And they said, lawmakers at that point knew that was going to how it was going to happen. It's cause and effect. We make health insurance available to everybody with pre-existing conditions. Guess what? Health insurance rates are going to go up. We need to figure out as the government a way to do this and a way to make it less expensive. So introducing the Advanced Premium Tax Credit, or the APTC, if you will. So the Advanced Premium Tax Credit exists to make health coverage more affordable. And so Advanced Premium Tax Credits are available to anyone that does not have access to employer coverage, Medicare, or Medicaid. And what these do is they work on a sliding scale. So they say, whatever your modified adjusted gross income is, we're going to pay a portion of your health insurance premium based upon your income. So as your income goes higher, you get less of those tax credits because the federal government says you don't need as much help helping to pay for your health insurance. Whereas if you can drive your modified adjusted gross income down, you can take advantage of these advanced premium tax credits. And one thing to note is that it's looking at a forward-looking estimate of your income. And so as we're enrolling people to start health insurance coverage on January 1st, 2025, we're going to say, what do you expect your income in 2025 to be? And they make an estimate, and your advanced premium tax credits, or the subsidy you receive on your health insurance, is based upon that figure. Now, all of that to be said, it's your modified adjusted gross income. And Dylan, you're the financial expert here. You know that there are ways to control modified adjusted gross income, and kind of you have some wiggle room for some folks. And there are ways to optimize for health insurance, by keeping that modified adjusted gross income low. And so there are tax efficient strategies, there are healthcare efficient strategies, there are estate efficient strategies, and sometimes they can all work together. But it's important that's where you come in, Dylan, and where Quorum comes in is making certain that all of the strategies that are at play are playing nicely together, including healthcare strategy. And so, the health and wealth, we say they collide often, and this is one of the bigger places.